Hi, my name is Donna Woolums. This is the third assessment, and my subject today is Amber. We're going to start with the belly. First of all, we're going to look at the belly. Notice the contour of it and how it lays out. Look, observe, make sure there's no masses or any bulges. Pulsations noted. I'm going to have you cough. Okay, and then take a deep breath in. Okay, and let it out. And now just lift your head off the pillow. Okay. I've divided the abdomen into 4 quadrants with the navel being in the middle and up and down. I'm going to start in the lower quadrant. Listening to make sure she has vowel sounds. With the bell of the stethoscope, we will listen in the epigastric area. To the left of that is the aortic, and I will listen to see if I hear any swishes or bruits. I'm present. Then the renal arteries to the iliac arteries. And no bruits heard throughout the entire abdomen wall. I'm going to percuss the abdomen. Dullness up here where the liver would be. Dullness toward the spleen. Tympanic in the other areas that are air-filled. Now I want to percuss upward to your liver, and we're going to measure where the tone changes. Right there. And then we're going to percuss downward. So try to find about the 5th intercostal space. Right there is a tone change. Liver is 3 centimeters. Palpate outward for the spleen. We'll find the area of dullness. There. Palpating outward. And that will be her spleen. Palpate your 4 quadrants. So if you feel any tenderness, let me know. But I'm feeling for masses or any enlargements of organs. Sometimes you can palpate and feel for stool. Her abdomen is soft, and I don't feel any nodules. Costal margarine here. So I want you to take a deep breath in and let it out. Okay, now take a deep breath in. Okay, did not feel her liver. We're going to try her spleen. The same thing. Now let it out. Now deep breath. Okay, could not feel either organ. For the kidneys, and if this is a deeper palpation, unable to feel the kidneys. And then to palpate for the aorta, you want to come in here, position, and try to push against. You cannot feel the aorta either. Or ascites in the abdomen, we could do the fluid wave test by pushing in to watch to see if the fluid goes across. And you would push and look down here to see if you have a wave of fluid. Inguinal area, and I'm going to palpate through her shorts and just see if I feel any masses. And I do not. And nothing felt. No tenderness. And no hernias noted. And we're going to feel for her pulses. They're present. And they're equal bilateral. Feel right here. And this is checking her temporal mandibular joint. Find it. Okay. Now open and close your mouth. Okay. Am I hurting it? No tenderness? Okay. Clench your teeth real tight. Okay. No pain? Okay. Other side. Okay. This is flexion. Then let's extend your head backward. Okay. Very good. Teeth real tight, and don't let me open your mouth. Okay. That is testing the strength of the mastoid muscle. We're going to look at the cervical spine, noting all the little ridges through here. Note your skin color, that it's normal tone. There's no lumps or bruises noted. We're aware of vertebral muscle. We're going to come down this way, looking at her trapezius muscle through here. And then she'll turn her left and then palpate over here for the other sternocleidomastoid muscle. Okay, tilt your head, chin to chest, flexion. Then let's extend it back up to the normal position. Okay, and then hyperextend. Very good. There we go. Then to the right shoulder. About 40 degrees is what it should be, and then take it to the other shoulder. Okay, any pain? They were equal bilaterally. And then let's rotate it this way, and then rotate toward this. And a rotation should be about 70 degrees. With me holding it, try to make it go that way. Okay. Has good strength and resistance to my hand. Would check cranial nerve 9. At her shoulders, and now I'm going to look, and we've noted already that her skin tone was normal. There's no bumps, no bruises, no masses or lesions are seen on observation. So we're going to palpate her scapula. Then we're going to, each side, we're going to palpate around her humerus. Through here. And over here. Make sure all of her joints have no fluid in them, or don't pop or have crepitus under my palpation. Now I want you to lift your shoulders up and down. Okay, very good. Now hold your arms out to your side. Okay, and can you take them over your head? Very good. And then can you hyperextend them behind your back? Okay, about 50 degrees, and that's normal. Now put them to bring them back and bend them in for internal rotation. And the shoulder movement for the range of motion. Let's take your arms and put them behind you. Okay, very good. Now fold them up towards your back. Internal rotation. Then let's put them back in. Yeah, up over your head, which is abduction. And then bring them down behind your back, which is external rotation. Now can you move that without moving your upper arm? Pronation and then supination. Okay, let's do it with this arm. Tighten up and let's test your strength. Very good. Let's test this one. Okay, very good. Note if there's any nodules on any of the joints. No, that's just your joint.
Got one right there.
She has a rehab that she can do flexion, extension, and hyperextension. Let's do the same here. Going to take them down, okay, back up, and hyperextension. Very good. With both your hands, very good. And can you bring your thumbs over? Very good.
Oh, for 60 seconds?
No, we won't. Okay. I'm having her hold in the Fallon's test with her wrist flexed, and there has been no pain. Okay, you can release. Tap on it and make sure there's no pain. And the same on her left wrist. Looking at her legs, I want to note the size of both legs, that they're equal. She has no bruises, no masses, or no nodules can be seen. Now I'm going to have you flex your hip, which is you're going to extend it straight up, okay, and then put it back down. And this one. Did you have any crepitus or did you feel any pain during that? Okay. I will palpate both joints. Okay, both are equal and feel normal. Now one at a time. Okay, very good. And the other one. Very good. Hyperextension should be about 30 degrees, and it will. Your knee and bring it all the way up to your hip. Very good. And let's do the other one. Bend the knee, bring it up. So that's flexion, and this is extension. And no pain was felt with either of those. So bend your knee up, bend at your knee, and take it to internal rotation. Is putting it in toward the body. And now let's bring it outward. That's external rotation. Way in toward your body. Okay, and out for external rotation. Oh, let's try the other leg. Pushing downward. Good. She has good resistance to my pushing. Palpate around them and make sure that there is no fluid in the knee or in the joint.